Hello everyone, my name is Lieutenant Dale Wilson, and I will be giving you a tech talk today on state-of-the-art medical simulation facilities. Our objectives for this topic are going to be to perform an overview of medical simulation facilities, identify established state-of-the-art medical simulation facilities, discuss the composition of a state-of-the-art medical simulation facility, and identify how a small, low-budget facility can build an effective facility. Starting with an overview of medical simulation facilities, I'd like to give a definition of what a medical simulation facility is. A medical simulation facility is a dedicated area that is devoted to simulation for medical purposes. Some different settings or sites that you may see this in is a dedicated center, which could be hospital-based, school-based, freestanding. This could be in situ, which means it's within an actual clinic or the building that you're working out of. And these can be permanent or temporary. And we're starting to see an increase in mobile simulation units where they go out to different places such as nursing homes, to fire stations, and set up simulation. It's actually quite fascinating to consider that as an option as well. When looking at the different settings and sites, it's important to note the advantages and disadvantages of each. For a dedicated center, for example, some advantages include that the equipment is readily available. So you have a high level of control, it's easy to access, it's also easy to coordinate scheduling. You can even have multi-purposes for this area, and there's going to be limited interference as you all have a dedicated area for simulation. And it's also easier to scale up, as we're going to learn about later. Some disadvantages of a dedicated center include you have a limited exact recreation of various or diverse clinical settings. So if you set up a dedicated center as an emergency room or as a ward, it's hard to adjust that to make it specific to other communities of practice. Dedicated centers are also expensive. You need building spaces, you need crew and personnel to accommodate, you need cleaning services, you need electricity, you need all of the components that would go into running that facility. Sometimes it's also hard at dedicated centers to separate training from clinical work, especially if this is a hospital-based simulation center. It's very hard to separate those two entities to allow you to have as much flexibility as you're looking for or participation. For in situ medical simulation facilities, what's nice is you get to use real equipment since it's in-house. You can also tailor it to the needs of the people at that location. And the proximity to work, you're at the work center, so it makes it easy to get to. It's also less expensive than the dedicated centers. But for disadvantages, you'll have interference with actual work as it's in the same place as work. It's possible that that space could also be lost due to clinical need. If they need that room for a patient or that area for something else outside of simulation, you could risk losing that space. And it's also harder to scale up because you're limited to your location. I mentioned mobile simulation, and this is fascinating. The advantages are you can go direct to the consumer, and the advantages are going to be very similar to in situ. For disadvantages, you're going to have increased transport costs, especially if you're using a lot of equipment. You're going to need larger transportation methods to get the equipment to the site. And again, the disadvantages are similar to in situ. So now that we have an understanding of medical simulation facilities, the settings, and the advantages and disadvantages of each of those settings or sites, I'd like to direct you to this reference that I've included on the slide. It's produced by the Society for Simulation in Healthcare. And what it is, it's a directory of all the simulation centers that exist. What's really neat about this is it's an inventory separated by region, and it includes specific criteria that you can identify and sort through to see if it meets your needs or to coordinate, collaborate, and work with sites that are around you. The site offers you the opportunity to look at North America, specifically the United States. You can also search for simulation centers in Africa or in Asia, Australia, and the Pacific Islands, Canada, the Caribbean, Central America, Europe, the Middle East, and South America. So it truly captures as much data as possible of all the simulation centers globally. If you have a simulation center that's not on that website, you can submit it so that it can get added to the inventory, and it also allows you to look at accreditation through that society. So now that we have a good overview of medical simulation facilities, I'd like to transition now to examples of state-of-the-art medical simulation facilities. State-of-the-art, by definition, means that it is belonging or relating to the most recent stage of technological development, having or using the latest techniques or equipment. And what makes these facilities stand apart is that they have features that are not as common as other facilities. And so, for example, I gave you a list here, such as Johns Hopkins Medicine Simulation Center, the Stanford Medicine Center for Immersive and Simulation-Based Learning, Harvard Medicine Center for Medical Simulation, and Hartford Healthcare's Center for Education, Simulation, and Innovation, abbreviated to CESI, which we're going to expand on that one on the next slide. This is not an all-encompassing list. There are many more out there, and some that you may or may not be familiar with. Let's go ahead now and take a look at Hartford Healthcare's CESI. Again, that stands for Center for Education, Simulation, and Innovation. This dedicated simulation facility features over 50,000 square feet of space and is located on Hartford Hospital's campus in Hartford, Connecticut. CESI's vision is to provide clinical personnel with sophisticated education and training programs to help improve safety and quality and better manage risk throughout the system, and to provide industry clients with sophisticated programs to advance their R&D efforts, readying their products for market, and training both their sales teams and their end users. The facility is able to accommodate a very diverse range of students or clients. For their training, they've trained SWAT teams, hospital staff of varying levels. They've trained paramedics, EMTs, as well as flight crews, military personnel, and many other different types of clients. For their R&D efforts, a lot of companies will come to their facility to use the mannequins or live tissues that they have to test their products out, to train their sales teams, and also to train the end users, which are usually surgeons, the first assists in surgery, the surge techs, anybody that would be involved in any of the products. This picture here is when you walk through the entrance of CESI. I like to highlight this because it shows you a very interesting quote to think about, which is teaching tomorrow, today. And I think that's important when we're talking about state-of-the-art medical simulation facilities and how they set themselves apart. A lot of that is based off of their vision, their perseverance, and their identity. And so CESI takes great pride in their identity, and it's reflected in how well they are able to deliver their service to their clients. Taking a broad overview of CESI, I'd like to highlight some key features that exist within the facility. First is the BioSkills Wet Lab, and this is 5 separate suites comprising of 16 spacious workstations where clients can come in and train on specific needs. They can train on live tissue, and they have a lot of space to learn, to do R&D, and many other things. The clinical simulation lab area is 10 dedicated specialty simulation rooms that are designed to mimic clinical spaces such as an operating room, an emergency room, or an ICU. And each of these are linked to its own control room behind a 2-sided mirror where the proctor can deliver script, feedback, input while monitoring from different camera angles. They do use some high-tech AV equipment, and it's quite fascinating to see, and we'll see some pictures later. They do have an area specifically for procedural task training, and it's 1,200 square foot. and they call it their arcade. And here they have different stations set up. They can swap out equipment to perform training on specific tasks such as suturing, chest tube placement, intubation, surgical training, task trainers, all kinds of unique and fun stuff. They also have various meeting spaces and also an amphitheater that seats 75 people. And again, it is fully enabled with AV equipment throughout. Through this equipment, they can also live stream pretty much anything that they're doing from any of the rooms, and they can stream it within Hartford Hospital into classrooms inside the hospital or to remote locations, which I think is really fascinating. And it provides for a longer range delivery, especially if folks aren't able to participate in person. It extends the reach of that training. Looking at the organizational structure, they have various directors. One is the executive director. They have a director of operations who we're going to hear from later in a video, Steve Donahue. And they have a medical director, Dr. Nowicki, who is an emergency physician, and he oversees all of the medical components to make sure that the scenarios are sound and medically appropriate based on the needs of the client. There's one data manager. She coordinates the schedule and programs to ensure that everything is needed. For a lot of their programs, they do provide lunches, especially if it's an all-day evolution, so they'll provide breakfast and lunch, and she coordinates those efforts as well. She oversees the supplies and makes sure that each department is taken care of. The three departments within CESI are the simulation, Bioskills Wet Lab, and the EMS departments. Each of these departments have their own department head or manager and supporting staff underneath them. I'd like to now go through each of those departments and give you an overview of what they offer, starting with the simulation department. CESI Simulation Department offers 10 dedicated simulation suites, as well as the task training arcade that I mentioned earlier. The dedicated simulation suites include a 4-room patient ward with a nursing station isolation room, and what this allows is for a replication of the area and bringing in a team that works together, usually on a ward, to train with high fidelity on the clinical skills and non-technical skills of their unit. Other spaces that they replicate include a labor and delivery room, a resuscitation room, ICU room, trauma and emergency department room, operating room, or anesthesia. And by doing that, they have dedicated spaces to provide for individualized clients, and they can also take those rooms and adjust them accordingly to accommodate other clients. The task training arcade is dedicated for procedural task training, and it covers a wide range of medical procedures. Also included is a robotic training suite with simulators. Some of those are virtual reality or augmented reality. Also included are 2 Da Vinci surgical training systems. And what's fascinating about this is they basically hooked it up to an Xbox, and they have a screen that a proctor can monitor to see how the performance is going on that Da Vinci unit, and give that training to the surgeons and the surgical assist clients. Here are some photos from the task training arcade. Notice the high fidelity of the mannequin on the left. In fact, the hairs have a unique texture to it that makes it authentic. On the right, I'd like to highlight the mannequin with the white drape over it. That's Harvey, and Harvey is unique because it is Bluetooth capable, to where you can have virtually an unlimited amount of students put in Bluetooth stethoscopes, and they can go over heart sounds and listen together at the same time as the proctor demonstrates the various sounds, and it's programmable. Here is a picture from the control room of one of these simulation suites. And so in this area, the proctor would sit down. They have full control of the mannequin. If you look at the window, that is actually a 2-sided mirror. And so the participants, the clients, the students would not be able to see through to see the proctor. It limits distractions, which I think is very nice. Additionally, you'll see in this room that the proctor has the ability to fully control the mannequin, as well as a microphone to provide audio input as needed. The computer monitor on the right, you'll get an idea of some of the capabilities that they have when it comes to observing the clients, the students. And so one of the views is a bird's eye view, and the other two views provide different angles so that you can better observe and see exactly what the students are doing. If they're doing it correctly, it allows you to identify triggers that would change the status of the patient and make notes for debriefing. Overall, this space is designed quite well, and it really allows for that separation of the proctor and the clients, and allows the training to go with minimal distractions while also gathering all of the data of the performance. On this slide, you'll see some photos of some of the more unique or higher level task trainers that they have at SESI. On the top left, you'll see the Da Vinci systems that I had mentioned earlier. On the top right, you'll see this table, which is used to practice line placement, and they do that via virtual reality. And on the bottom, you'll see a student using the task trainer for transvaginal ultrasounds. Moving on to the BioSkills Wet Lab department at SESI. This department is responsible for the R&D, the preclinical testing, and hands-on training. They offer both human and animal models. It features 2 large training laboratories, 16 fully equipped workstations that accommodate up to 42 participants. As like everywhere else at SESI, it has advanced AV technology. What's interesting about this area is that it has on-site instrument processing. It also has all the appropriate PPE that would be needed, as well as a locker room to change in. And this area is temperature and humidity controlled, and it also has HEPA filtration. This space is secure and confidential. Again, a lot of R&D is going on here. A lot of medical or surgical device sales companies come in to test out products or to train, and it really is a unique and fascinating area. This picture here shows you one of the areas of the BioSkills Wet Lab, and so you'll notice the open space as well as individualized workstations, so it allows for a lot of individualized work or collaboration. SESI is a certified facility with dedicated rooms for training emergency response professionals. This falls under the Emergency Medical Services Department at SESI. Some of the courses they offer include, but are not limited to, advanced life support or advanced cardiac life support, advanced trauma life support, basic life support, basic first aid, pediatric advanced life support, and TCCC, or tactical combat casualty care. And yes, they are certified and have trained the military on TCCC. Here are some photos from those training courses conducted at SESI. Next, I'd like to transition to hear from the Director of Operations at SESI, Mr. Steve Donahue, and the story. And that's going to explain how they started from a very small, low-budget operation and turned themselves into this giant, state-of-the-art medical simulation facility.
Steve Donahue, STEPHENDONAHUE. I am the Director of Operations for the Center for Education, Simulation, and Innovation, located in Hartford, Connecticut on the campus of Hartford Hospital. I want to talk to you today about the evolution of simulation at Hartford Hospital and take you through our journey to become a small startup place to a very large training center and our relationship with the Navy along the way. So in 1999, Hartford Hospital was interested in bringing a mannequin to our campus. However, at that time, there was no funding available to purchase the mannequin. So the first mannequin was actually purchased through the University of Connecticut Medical School Department of Anesthesia. We brought in a mannequin that was a very large, heavily wired mannequin with a portable AV card attached to it, so it was very, very cumbersome. But we brought it in and we put it together and we started doing training. At that time in 1999, we didn't have a home. So we acquired or found or stole a stretcher from the operating room, and we put the mannequin on and we would do training throughout the hospital. We found it very difficult to find open rooms to do training in, so we do codes in hallways, stairwells, cafeteria, just to create the buzz. And we did create a buzz because people were a little surprised at the mannequin when they first met the mannequin, and they were a little annoyed at them being interrupted during their clinical practice to do training. We really kind of sputtered around from 1999 to 2004 trying to identify our identity when it comes to SIM. And it was a very difficult concept for administration to buy into because they couldn't see what simulation could be, even though the aviation industry and the military pioneered simulation-based education. Hospitals were having a very hard time seeing what it could be, and traditionally hospitals are very reactionary towards a problem versus proactive to prevent harm to patients. So we did sputter for a number of years. In 2004, we opened up, or I should say kind of opened up, I squatted in an old labor and delivery C-section operating rooms. It was about 900 square feet. I set up shop in there. Unbeknownst to my hospital administration, I set up a shop up there and started running classes up there, and started to get a lot more interest from our residency programs to join, and really started to grow from that point with our residency program. In 2004, at the same time, I was offered at that job was the program director for our training center, and I was asked to find some revenue to bring into the simulation portion of that. At that time, it was the Connecticut Simulation Center was the name of it, is to find some revenue. So I reached out to the United States Navy down at Groton, and it took a while for me to find the right person, or for the right person to actually call me back. But I was really delighted when I got to meet Dr. Jeremy Burke, who was down at NUMMI in Groton, and we finally got to connect, and he came up and saw my makeshift sim center, which was truly makeshift sim center, but he saw what it could be, and he saw the benefits it could be for the IDC students. And our relationship really started in the early 2004 with the United States Navy IDC students, thanks to Dr. Jeremy Burke. It has evolved tremendously from that point on. When I say the relationship with the Navy has evolved, so has our simulation here at Hartford Hospital. We are now have expanded to a 53,000 square foot training center that encompasses a cadaver lab, a live animal lab, 10 high fidelity patient simulator rooms. We have an EMS section that we teach our paramedics and EMTs, but we also offer tactical courses as well. So the tactical combat casualty care, as well as tactical emergency casualty care as well. So the CCC programs can be offered here at Hartford Hospital. So we have grown tremendously. Our operational budget is almost $2 million now. I have over 30 employees from my beginning when it was just me, myself, and I, to over 30 employees now, a very talented group of employees. And our relationship with the Navy, I'm so proud of our relationship with the Navy that we continue to be a great partner in their training programs. And now we not only offer it to the IDC students, we offer this great facility to the IDC active members, and we also have the UMOs coming to SESI as well. We also have other military branches have joined with us, but I am a pro-Navy guy and always will be a pro-Navy guy. So I really wanted to kind of share our experience here on how we went from a very small startup center to a really mega startup, mega training center, and really how we became a mega training center was perseverance. I really wouldn't let it go, and it took me a long time to find the right executive leader to buy into this. Mr. Jeff Flax, who's the president and CEO of Hartford Healthcare, saw what SESI could be, and he invested quite a bit of money into our training center, initially $10 million. Since then, the state of Connecticut has invested $15 million. The hospital matched, and we raised $4 million of private donations. So We are roughly now, with all the capital equipment here, about a $43 million training center that is, again, 53,000 square feet plus, that has a lot of the technology that any healthcare provider will benefit from. So I just want to take a few minutes, thank the Navy for their commitment to SESI, and I thank you all for your service and what you do for us each and every day.
That's a really unique story of how a very small, low-budget operation turned into a state-of-the-art medical simulation facility. SESI is an awesome place to experience. If you ever have the opportunity, I highly recommend going there for some training or just to see the facility. In summary, medical simulation facilities vary greatly with advantages and disadvantages for each. State-of-the-art medical simulation facilities take time, perseverance, and resources to develop. You have to build from your current capabilities. In order to do that, you have to have a vision. You have to see and look to the future. What are the opportunities that are going to exist? What is out there? What are the objectives you're going to need to meet in the future? And what are the stepping stones and ways to get there?